Thank you. Our QR code should be popping up here shortly for that session. There we go. Can we get it up on the screen? Yep. There we go. It's like watching everybody looking for water in the desert. So while you're all doing that, I'm going to welcome up here Tim Clifford to introduce our next presenter and award.
My name's Tim Clifford, and I'm one of the professional development trainers for the Sandy Mark Group. And I would like to introduce Rhonda DeMarco, who will be joining us from Alberta virtually. Let's see, 6:25 her time, 9:55 in Newfoundland. So, she is the winner of the Sandy Mark Environmental Research and Innovative Stewardship Scholarship. Rhonda will provide. Rhonda will provide an update on the results of her winning project, ICAB, Improving the Configuration of Ambulance Bays. And afterwards, there will be a question and answer period in which she'll be assisted by Sandra Bolton, a member of her team who's attending the conference live. Rhonda's been a registered nurse for 32 years, and she describes the path up to now as weird and winding, which you may all relate to, and that it has become the best job ever. She's been an ICP for 12 years, 7 in acute care, and the past 5 with emergency medical services in Alberta. Early in her transition to EMS, she recognized a need to make changes in this space. Was the timing perfect? No. The pandemic hit 5 months later. And as you know, everything else was put on hold. Ambulance bay changes had to wait. I love this story so much. I want to tell it, but it's Rhonda's. Take it away, Rhonda.
Thank you so much. All right. Let's see if I can get my screen shared. That's always the challenge, trying to make everything go away, right? There I am. Okay, you can see that all right and you can hear me? I hope. Okay.
We can hear you,
I'll
Rhonda.
assume the best. So thank you so much, Tim, for that kind introduction, and to IPAC Canada and Sandy Mark Canada for the opportunity to complete this project and to be here today to tell you about it. So I tend to be a bit of an informal speaker. So that might be a bit of a switch. This project, as you're aware, was funded by Sandy Mark Canada. Thank you again so much. And I would like to also thank Alberta Health Services, Health Systems Knowledge and Evaluation, which we call HSKE, for their collaboration on the project. They are the data people. I am not. So they helped with the data collection and pulling all of that together. So I was hoping to be there in person and see hands and stuff, but so I'll just maybe change this up a little bit. I'm not sure how many of you might have been out to ambulance bays at your site. If there is one at your site, if you have been out, were they clean and well organized, or were they being used as a big storage garage for other departments' broken equipment and the bags of pop bottles for the bottle drive, which, by the way, attract fruit flies, so we don't like those in the ambulance bay either. So ambulance bays have forever been seen as a space to park ambulances and apparently to store items that are in the way of other units. You may not be aware that patient care occurs in the ambulance bay as well. So in particular, during busy seasons, respiratory seasons, so forth, when emerge departments are very busy, paramedics have to often provide patient care in the back of the ambulance, sitting in the ambulance bay while they're waiting for the patient to get a bed. Something else is that paramedics, they're actually required to continue to provide care for that patient until the care is actually legally transferred to physicians. So if you see paramedics hanging out in emerge, that's likely what they're doing is kind of protecting everybody by making sure that patient has care the entire transition. So ambulance bays actually are not just a place to park ambulances. They provide storage for medications, clean and sterile supplies, and paramedics do the cleaning and disinfecting of the ambulances and the shared patient equipment in there. The risk is higher of contamination in these spaces. If you imagine maybe keeping the linens for your home in your garage at home. How would you want those to be stored? Probably not just sitting out in the open collecting dust. You would want those to be protected somehow. So we did a literature search so that we could maybe tweak somebody else's ambulance bay audit tool, and we could not find one. We wanted to find one to use as a template, and there was no such animal, so we decided to produce our own. In order to kind of figure out where the ambulance bays were at in the province right now, figure out where our challenges are. There are always challenges in healthcare, and just to kind of get a sense by doing this environmental scan of where we're at provincially. Okay, so the results were from two methods. One was the project, and the other a survey and focus group. And so the survey we put it together super fast after winning the award in, I think it was March. And then June to September, we conducted the survey. The respondents were infection control professionals from across the province, both rural and urban. And the audit tool was deployed using a secure web application so that we could collect data quickly and it was safe. Next was the focus group. It was conducted in a virtual format in November 2023. And so we pulled in people from each of the 5 zones in Calgary, in Alberta, who had participated, and asked them to give us some feedback. And, if we all work in IP&C, and we know that there is no shortage of feedback or edits or offers of changes. So that was very effective. And then the audit tool piloting. So after meeting with the ICPs, then in April 2024, after some changes were made, the audit tool was presented again with the changes, and the focus group had a look at that and trialed that as well. So this maybe doesn't look great. We selected ambulance bays specifically that were attached physically to acute care facilities. just because we had a 1 year time constraint to get all the data collected and produced and put together for a presentation. And so we have about another, I think, close to 100 ambulance bays in the province that were not part of this. And those would be like rural, freestanding ambulance bays, and they are a whole different animal. We selected the 95 ambulance bays in the province that were connected to those acute care sites. The response rate, I know it doesn't look fantastic, 47.4% across the zones. But let me tell you, it was a terrible, terrible time last spring when we were trying to do these audits. And this entire part of our province was either burning or impacted by wildfire smoke. A lot of these places were being evacuated, and so there was a lot going on. Nobody was barging into that to do an IPC audit. The other thing you'll notice is that the bulk of, everything's fairly close together in the southern part of the province, but up here, sometimes the ICP for a site might be here and they have to drive all the way up to the top part of the province, might be 7, 8 or more hours of driving, then a hotel stay, then the audit and some other IPC work the following day, another hotel stay, and then a drive home, which is not particularly fiscally responsible right now. Alberta has one single health authority, so it was awesome that we were able to at least get the audit or the audit tool trialed. And right now, you may or may not be aware, we have some political change in Alberta, so I'm not sure how long we'll be, sort of one group, and it will be as easy as it was last year to try to get things done across the province. So surprise was, at least to me, that 2/3 of the ambulance bays were considered clean and well stocked. Of course, there was variability and inconsistency, and we kind of expected that. The results showed we certainly do have some current areas of excellence, which I had no doubt, of course, we do. And then areas for optimization or improvement is the other word. We really found this one at the top here, the clear designation of roles and responsibilities is one that was a reoccurring theme. So ambulance bays, as I mentioned, they're kind of a black hole. Nobody's responsible for them, and often there's no environmental services in there. Most of our sites, I think we receive buckets with disinfectant that's been pre-mixed by environmental services, clean mop heads, and they remove the garbage and the dirty mop heads. But generally speaking, our paramedics do the bulk of the cleaning in ambulance bays. So yes, we did discover absolutely very important for the ICPs to call ahead, see if somebody can meet them there or even just be there, anybody. So if you're an ICP who's never been in an ambulance bay before and you're suddenly handed this audit tool, it would be a bit difficult to figure out where you're supposed to start, what you're looking for, and ambulance bays do not look like acute care units, so they're not as clean, and so you might think the whole thing is super gross, but depending on who's looking at it, I guess I might look at it and say, no, actually it's good. And I have some pictures to share with you in a minute that will show that. Again, the clear definitions and use of terminology were suggestions to improve clarity. I also think, I'm not sure if all sites do this or if it's an Alberta thing, but we usually sites have site rounds, which include the site director, workplace health and safety, somebody from maintenance, somebody from IPC, and then you have a unit that you pick and you go there and walk around and find all the potential deficiencies in that space. These are not being done in ambulance space because they're not seen as patient care areas. So I think it would be kind of cool to, even like every year or 2 years, I'd be thrilled if we could do that. The original survey, or the one we used to do the initial environmental scan, I maybe didn't use appropriate wording, so this was a question that was on there, and we changed it to be more infection control friendly, so no porous materials. That's more the language that we are used to. Also, due to feedback from participants, HSKE changed it so that they could comment on each, well, it's sort of a group of questions. We separated the audit tool up into linen carts, supply carts, and such. So there would be a group of questions. Now there's an opportunity for them to upload photos of anything they might have concerns about or things they think are really good, and then send it in. Oh my goodness. I am on the wrong slide. So as I mentioned, this is a very overlooked area of healthcare, and we are super duper enthusiastic about improving this space, as well as the storing of supplies that will be used on our patients. So we think this audit tool will not only be beneficial to Alberta EMS, but also to EMS providers across the country. After the, oops, oh no, I've done something terrible. After the audit tool or the environmental scan, then staff were pulled back in. 7 out of 10 completed the auditing, again with the improved information or the improved audit tool. When it was sent out, it was actually intended to get information regarding wording and grammar and how user-friendly it was. But, you know, ICP is always keen to help. They sent all kinds of really thorough edits and suggestions that we weren't actually looking for at that time. We were just making sure we had put in the changes that they requested and that it was working properly. But we will always accept the teamwork. Here's a sample of the audit tool. Pretty much looks like this. It was done in REDCap, which I understand not everybody has access to. We are planning on making the final audit tool available to others for use, to adapt or to use as is, with copyright. We are just sorting out the copyright stuff right now. So we want to make it a friendly copyright that allows you to adapt it and use it. So these are the questions that we are asking. You can see how if there is no paramedic or site person in the ambulance bay when the infection control professionals show up to do the audit, they likely are not going to be able to find out if the carts are topped up or if the whole cart is replaced. They would have no way of knowing that unless they ask somebody. So again, with the lessons learned. I don't know why it's doing that. Why are you doing that? Okay. Oh, good. All right. So, I think if you consider again things that are stored in your home garage, probably nothing in there would pass the white glove test where you wipe your finger across something and see if you collect dust. Chances are pretty good you will. So our goal is to make sure that things are protected the best they can be. There are ways that we can do that in ambulance bays, and we have some beautiful carts that are supplied for EMS that are not always used in the EMS space. We used a mixed methods approach, so quantitative information that was gathered from the survey and the qualitative that was gathered from the working groups and consultations with the ICPs who participated in the audit. All right, pictures. All right, so this is an example of good supplies. So these carts are for EMS in particular. They actually have locks on the cabinets. The doors should remain closed unless you're rooting through them for supplies. This looks pretty good. The cart doors are closed except the one that we're looking in. Even the IV bags have been kept, thank goodness, in their exterior wrappers. Everything seems to look pretty good there. This is an example of a rural ambulance bay, but it's also a good example of supply organization and cleanliness. I kind of dig how they use the pink basins for supplies. Whatever works and keeps things organized. The wooden cabinets without doors, certainly not ideal. This is likely a contracted service as well, being a rural ambulance bay, and they tend not to have the same generous funding that maybe larger EMS organizations have. So I'm just really thrilled that they have everything really neatly organized, divided by bins. And then what I would ask is if this was your space, next time there's any renovations or construction being done in Emerge, just ask. You'd be surprised what you can get if you ask. Just ask for, could we get metal carts with doors or even just doors? Could we get doors? And usually they will provide that. It's not really a big ask. This is a great example of the inside of an ambulance bay and how they're storing supplies. All of the oxygen tanks are secured safely upright. I do not know whose locker that is or what's in there, but I'm happy that it's there and it's got a door and the door is closed. And these bins are sealed. The lids are on and locked. So, or well, clipped, I guess is the word I should use. But so yeah, it's lovely. Here's another look at a bit of a closer look at supplies in a cabinet. This is what I like. So oftentimes when you look inside the bins, you see a bunch of dust and paper and dirt and stuff. You can actually see the reflection here of these little slats that are in here. So that's super clean, shiny. Somebody is taking care of this space and it makes me very happy. Keeping in mind that this is not an inpatient unit. This is really, this is a good example. This is eye wash station and a decontamination shower. Patients and paramedics have to be decontaminated more than you probably realize. So if the paramedics are bringing in a patient who's had an exposure to, I don't know, pesticide or some chemical or something and they bring them in, then everybody is being decontaminated. So I do like this space. It's clean and private, especially with all those lovely windows where you can see outside. They have curtains here and the eye wash station and the shower is clean. This is This is a very nice ambulance bay, and I know acute care folks are going, what? But it really is from an ambulance bay perspective. Laundry is here, garbage is here. They've got the bin here with the clean garbage bags in it, buckets and mops over here. Supply cart has the doors closed, and there is room for the ambulance to come in without running over stuff. So this is actually a pretty good example. This I love a lot. Most ambulance bays do not have this beautiful space. It's a cleaning space. This is the mop sink. A lot of places don't have this nice of a, hand hygiene sink. So this is their cleaning area. You can see they've got their MSDS up here. It's got a plastic protector on the binder. I can't believe all of the mops and stuff are actually hung up where they belong. And that is one shiny paper towel holder, man. Looks like a mirror. So I'm pretty happy with that space. All right. So I know everybody is probably thinking, ew. So don't pay attention to the wall. This is a wall in a garage. So nobody's cleaning those walls. I don't know who we could even ask to do that. So that's probably a lot of dirt over a long period of time. I'm actually looking at the hand hygiene sink, which is uncommon to begin with and very appreciated. Paramedics deal with patients who have C. diff or neuro, and they want to find a hand hygiene sink to use soap and water. Sometimes they're wandering through the emerge to get to the nearest sink. It would be fantastic if paramedics had regular access. The sink is clean, even though the wall is not. There's no overflow, it's hands-free, and this is a good space. Another example of the EMS supply carts, the problem here, it's more of a WHS issue, is that when things are stored on top of these carts, then people reach up for stuff and things hit them in the face. I did see one ambulance bay that had made their own little tent cards for the top of these carts that say, do not store items on top of these carts. I thought that was a pretty great idea. Another good example, all of the supplies are where they should be. The oxygen is all stored safely. These supplies, I think, were just dropped off. In the whole photo, before I had to crop it, you could see a box over here that had been opened and they were starting to empty it out. EMS is not allowed to pick the times that they get 911 calls, so often things get left half finished. So that they can go out and provide care. So switching off acute care IPC thinking, this is actually a good example. That's the supply list on the exterior of the cart, so that people know what's in there, where it is, how many they have or should have in there. You can see that it is laminated. This sheet, is in a sheet protector. It looks like it's seen better days, but this is, really not awful in the big picture. These paramedics also have the luxury of having their own bathroom. It's another thing we found with paramedics is that they are frequently found wandering the halls looking for the nearest available public bathroom because nobody will let them use theirs. So if we could have bathrooms in the ambulance bays so the paramedics can pee when they need to, that would be lovely. This is a workspace for them as well, also not typical in ambulance space. You'll frequently see them sitting in their ambulance trying to finish their charting and stuff. So this is a really nice space for them to be able to do their charting, have a coffee. It's clean, so that makes me happy. Anybody who's unaware of a Pyxis machine, it's like a vending machine for drugs. paramedics don't have access to medications, all the medications that they might have used on a patient, and they need to restock their ambulance before they go on their next call. So they use the Pyxis machine. This is the vaccination fridge. Also a lovely clean space. And just a reminder, this is great because it's in a private room, it's enclosed, but Pyxis machines should not be out in the ambulance bay because the ambulance bay doors go up and down a lot, and we tend to get things like mice and birds and bats and stuff, and we don't want anything to get access to those drugs, or the whole machine would need to be emptied and discarded and cleaned and restocked. This is, although not ideal, it'll work in a pinch. If we don't have carts with doors on them, then these cart covers are perfectly acceptable. It'll prevent dust from settling on the linens. Again, ignore the wall, please. What I'm looking at here is the organization. So the biomedical waste, garbage, laundry, and all of the signs indicating what's in each bin or bag or bucket. And all of those signs are laminated. So based on that, these are the current CSA standards for ambulance space. I really think they could be more robust. I would also like to see this change to a shall, as well as this for the hand washing sink. I'm not sure why it's a should, it needs to be a shall. And then I don't expect any facility to start doing renovations because of IPNC, but next time there's construction being done, perhaps they could consider that. That would be wonderful. So, yes, we did find challenges. We found differences depending on where the ambulance bays were, and there are difficulties for folks up in the north part of the province trying to get around and get there to do the audit. I think possibly we could consider asking EMS if they would help with those remote sites, because they've got paramedics going in and out of there anyway. And we are looking so forward to future work preparing our best practice guidelines for ambulance bays and implementing the audit tool province-wide. So I think I mentioned previously, we are currently arranging for this audit tool to be made widely available with a license, which allows for others to use and adapt it as long as they give credit to AHS. And so stay tuned, that'll be coming. And because I showed you ambulance bay pictures that kind of made you go, I thought I'd share one lovely photo from Alberta EMS. One of our paramedics took this picture. It shows off our lovely Rocky Mountains. Sorry, it's a bit fuzzy, but it's probably the nicest photo in the slide deck. And that's it. Oh my gosh, did I finish on time?
You certainly almost. And I know that we actually did go into Newfoundland time, so a little bit over. So
sorry.
No, you should have seen the reaction of everybody. It was it was quite heartwarming, actually. Yes.
Oh, good. I'm so.
For the questions and answers, I have been told that we don't have time. However. Sandra Bolton, can you just wave to everybody? She will be available here if you do have some questions to ask. And thank you so much, Rhonda. We're very proud to be associated with the scholarship on this. I will ask
Thank you
Jim.
all so much.
Yes, good.